so much. Thank you so much for giving me this opportunity to read our mentor, Prafful Vijaykar sir's books. We have already finished reading Theory of Suppression. We rather went so slow so that everyone can understand, and we want to learn rather than simply reading and rushing off through the pages. So everywhere we were trying to discuss about few rubrics wherever possible and discuss about few cases which have come to my clinic, etc. There have been inputs from doctors as well. So I would suggest all of you to switch on your videos so that it will be much more an interactive session, because we don't want it to be a one-way thing, no? So today, we are reading the third book of Dr. Prafful Vijaykar, that is My Assumptions of Miasm. Welcome you all once again to the reading club. So the third book of predictive homeopathy, that is the end of My Assumption of Miasm. So we as homeopaths, we all know how to do the case taking. We all know how to give them a constitutional medicine. And we all will wait after giving the constitutional medicine for a while, probably for 1 month or for 2 months, whatever. And when the symptoms come back, we are at a confusion, which means we have the difficulty in the follow-up. We don't know what to do. So this is what was cleared in the previous book, that is the theory of suppression. When the follow-up symptoms, whatever symptoms are coming up in the first follow-up, second follow-up, are on the level below the original symptom, it is a cure or it is going to the direction of cure. And if it is climbing up the stairs, if it is going to the next higher layer, then it is called as a suppression. This much we are all thorough with. Am I right? Are we all good to go? You are all thorough with what is suppression and what is cure. And if it is a suppression, of course, your remedy is wrong. So you have to retake the case and change the medicine, of course. And if it is partially simillimum, few improvement is there. But then how will you know the few improvement with a little amount of improvement? By the generals of the patient, right? If the patient is all good, if the patient's appetite is improved and sleep is improved, and his what to say, the go is there. The go is there for the enthusiasm is there, the motivation is there, but then the presenting complaint is not improved, then probably you can wait for a while. And if you think that it is partially acted, then you can always look into the relationship remedies. And now here we are going into one step further, that is we are going to discuss about the miasms. Miasm also give us a great idea, like what kind of medicine should you select, or what is the potency that you should select, and how often can you repeat, and plus the layer. The layer is important, the suppression layer is important, and the miasm is important. Now we are thorough with the climbing up and climbing down of the stairs of the layers. We are really thorough with that. With the miasm, added to the miasm, it will be completely pakka. So let us go straight to the chapter 1. Are we all ready to go? Give me some indication like thumbs up. Yes? All ready? Set? Now, here in the first chapter, yes, thank you, Sai Narendra. So, Dr. Vijaykar, thank you, Atira. Thank you, Arya Devi. Welcome you all once again. So, Vijaykar sir is a senior doctor. He has been having a lot of experiences. He also had a psoric phase. As we discussed in the last class, we all know what is a psoric phase. In the younger ages, you are all psoric. And then in the middle age, from somewhere around 25 onwards to the age of 40 or 50, you are in the psychotic phase. And thereafter, you go into the old age, that is rather the syphilitic age. Everyone passes out the BHMS in their probably 22nd age or 23rd age. When you are 23, 24 years old, you are just coming into the psychosis. You are still holding on to the SORA. You are not even ready to construct a clinic. You are not even ready to meet the patient. You are still in that boyhood or in the girlhood, and you want to settle. You will be having a charm, something like that will be there in your mind, and you are not really ready to face the patient. The patient is coming with full-blown symptoms. So there, even Vijaykar sir had initial setbacks, which taught him. With every blow, we go into the one stage more towards the success, right? With every failure, that is the stepping stone towards the success, right? So that was the success story of Vijaykar sir. Many doctors, all the doctors, not only doctors, engineers and all the other job wallas, everywhere they have a first day in their life, in their job. And there you would have been all under apprehension, anxiety, everything, all you would have forgotten to say many things. All these things happen. And later on, with the switch of the video, you will be, or with the switch of the light, you will be able to blah, blah, blah. That will come in your blood, no? And you will be an expert in that. So here, all these blows had made Vijaykar sir think, like, why did certain medicine work in certain case? Why did the same medicine did not work in a similar case? And why certain other thing happened in a third kind of case? So here he is explaining us the miasms, Sora, psychosis, and syphilis in much more details. So now, what is his experience? About 20 years back, I was called upon to treat a case of a 65-year-old lady, okay, lying in a hospital in a semi-comatose condition. How many of you have the guts to see a lady of 65-year-old, whatever the age is, in a semi-comatose condition? Yeah. In a hospital, you have to go, and in that hospital atmosphere, you have to go and examine the patient. How dare or how intimidated you will be for it. Just imagine that condition. It was not an easy job for a young, recently graduated homeopath. Yes. Despite the nervousness, I accepted the invitation and visited the lady in the hospital. I saw this lady lying in semi-comatose condition, not responding to any of my queries and compounding to my difficulties. When the patient is not talking at all, it is quite difficult for a homeopathic doctor to complete the case taking, right? The patient is not opening up only. The patient is very, just like that sitting. How can I complete the case taking? That is one big difficult task for a doctor. And here, it is a semi-comatose condition. So, I was told that, so Vijaykar sir would have asked the bystanders, like what had happened, etc. So he was told that she had gone into this condition after an attack of high fever, yes, and plenty of loose motions, okay? Bulb sparkling in your mind. She was still lying down with eyes closed. Suddenly, she started shouting and shrieking. Hold me, hold me. My head is sinking. My legs are going up. I'm sliding down. See, after a thorough inquiry with the relatives, I found that this was a regular feature, at least for the last 3 days. This type of shrieking was occurring at least 6 to 7 times in a day. I took a complete history and went home with an instruction to the relatives of the patient that they have to come and collect medicine from my clinic in the evening. This is what any inexperienced doctor will do, no? Because this is an acute case. When do you have to administer the medicine? The moment you see the medicine, when the moment you see the patient, so many bulb-on moments should happen in your mind, right? Is this pulsatilla? Is this arsenic album? Is this stramonium? Is this veratrum? Why is the patient in coma? Is this a soric coma? Or is it a psychotic coma? Or is it a syphilitic coma? Due to what reason did the patient go into coma? Or is it only a delirious state? So many questions should happen in our mind, right? And an experienced doctor will be able to give the medicine on the spot. But what did sir at that young age do? Any young age doctor would have done that, no? We are intimidated. We know to sit for 1 hour, 1.5 hours and take the case. The patient is already in coma and you're asking the bystanders a lot of questions. What is his desires? What is his thermals? Or what is his intake of water? Or all these, does he like biryani? Does he like rich food? Does he like sweets? See, look at this condition and you get a maze of symptoms. Some 2000 symptoms are there. You are happy. I have done the case taking in details. Father's father, all this past history, everything you have taken, and family history, everything you have completed. And you want the patient's bystander to come and collect the medicine in the evening. Anything can happen in that 8 to 10 hours. No, the patient is already in the comatose condition and she is already delirious. What do you think? Will anybody come and collect in the evening? Okay, doctor, I will collect the medicine in the evening. Will anybody be ready there? So what did doctors do? Dr. Vijaykar do? I worked hard on the case with my repertory and referring the books. Yeah. We want to cure the patient, no? Referring the books on materia medica, and I prepared myself to give a good remedy to her in the evening. In the evening, nobody turned up to take the medicine. Next day too, none of the patient's relatives came. Then we will be inquisitive, no? Like what would have happened to the patient? And somehow through some CID works, we had come to know that 3 days later, I learned that the same patient was seen by a senior homeopathic physician who prescribed on the spot. And the patient recovered even as I was deciding upon the remedy. Even after doing the repertory, even after doing the analysis and ruling out and ruling in of medicines, even then we will have a doubt, no, is that, can it be belladonna? Can it be stramonium? It has this symptom, that symptom. Even while deciding upon the final medicine, somebody had come and cracked the case. And yeah. Yeah, can you please go on mute, dear? I contacted the physician later and asked him what medicine had cured the lady. This was to enrich my knowledge. I was told she had been cured with Helleborus. Yeah, Helleborus. Why? The physician told me that whenever there is a case who is unconscious or comatose and the patient starts shouting or shrieking, one should observe the extremities. Yes, this is a very important tip, right? If the extremities show jerky movements or convulsive movements, it indicates cerebral irritation, and remedies which may be indicated are Helleborus, belladonna. Wow. I was happy. I had learned something. Yes, we also learned something. No, when a patient is under coma, we will also rather go into coma. No, we don't know what to see. When we feel the pulse, our own pulse, we will be feeling from the fingertips. Even the capillaries will be dilated like a radial pulse. No, and we will be like shivering, like with all the AC and all that. And all the bystanders will be like, whether this doctor will cure my father, well, whether he will be, what is he doing? Is he experienced? Has he treated semi-comatose patients before? With all these expressions on their face, they will be intimidating us, no? So we know it is not easy. So when a coma patient comes, so I shall give you one more input here. So we have to look into the pupils with a torch, the mobile phone itself. With the torch, you have to find out the reaction of the pupils. So if it is contracting or if whether it is dilating or not. If it is dilated, it is belladonna, right? And if it is pinpointed nucleus, it is opium. And look into the temperature differences of the extremities and the forehead. If the forehead is warm and the tip of the nose is cold, or if the forehead is warm and the tip of the hands and legs are cold, you can think about arnica, belladonna. Yes. And one side is warm and the other side is cold. These are all what symptoms? Subjective or objective? These are all objective symptoms. From because the patient is not, no, patient cannot answer. The bystanders, blah, blah, blah. They will not give us the point to prescribe. No, they will tell the story. We don't want that. Of course, we just want the ailments from. That's it. And so all these objective symptoms, like checking the pupils, then checking the temperature difference between the hands and between the upper part of the body and the lower part of the body, and looking for some jerks. That is what is mentioned here. So if there is any jerk, it shows that there is cerebral irritation and the medicine can be Helleborus or belladonna, etc. Quite a few years later, I was called upon to deal with a case which was in similar condition, another coma case. Only the cause was different. See, this is $100 million point. The cause of why did the patient go into coma is the most important thing for us as predictive homeopaths. The case was that of advanced astrocytoma with hydrocephalus. The symptoms were almost the same. The patient, a male, aged 37 years, was shrieking for a while and receding into a stupor. So what is this rubric now? Stupor alternating with shrieking, right? I gave belladonna single dose. There was no change. So here I want to attract your attention to certain rubrics of stupor. Stupor alternating with shrieking. Yeah, we all want to know the rubrics also. When we talk about the disease, we shall discuss about few rubrics regarding that particular disease, which will be of immense help to you. So in stupor, what happens? This condition, the stupor is alternating with shrieking. There is a rubric called mind stupor alternating with so many conditions. So in shrieking, what happens? In shrieking, There are three medicines, main important medicines. One is belladonna, as you know. The other one is epis. How about epis? That cry-encephalic will be there, no, in epis. That because of some meningitis, the cause will be again some inflammatory reactions. Or there will be edema also, no, in epis. So some infective pathology will be there in epis. And due to that inflammation and due to that edema, there will be lot of what? There will be fluid collection and there will be cerebral irritation. There will be cerebral irritation and the patient will be crying out, shrieking out and going into stupor and again shrieking out. So epis, belladonna and zinc are the medicines for stupor interrupted by screaming. This is the rubric. Now we shall go into few rubrics. Stupor after concussion to brain. Very, very important. The patient is brought after a road traffic accident. It was a mad accident and the patient had a hit on the brain, hit on the skull, hit on the head, or if the patient was not wearing the helmet. What would have happened? That is called as the concussion to the brain. Here, one of my senior doctors, Dr. Padmaja, was having a patient where the patient was like kind of a hit and run case. Patient was on the road. From the bike, he had gone up to some 20 feet high and then on his head, he had a fall and he sustained severe brain injuries. He was comatose on the spot. He was a young boy of around 25 and we both went to the ICU to treat this patient, see, and we just touched his body and found out the temperature difference, etc. And then the cause is like after a blow, after a concussion to the brain, we gave him arnica. Yeah, or rather Dr. Padmaja gave him arnica. What happened? The patient immediately opened his eyes. In 24 hours, the patient opened his eyes, but then thereafter, we could not proceed it. Eventually, we don't know the story, what had happened, but then for months together, we have been following up, but then there was no improvement. So arnica 200, we had given single potency, single dose. So we would have repeated or we would have increased the potency or all those, we were inexperienced at that time. So at least this is an eye opener. After giving arnica, the patient will definitely respond. Maybe from that time onwards, that state is over. So you should have gone to the next higher ailments from etc. Why did the patient incur with the accident? Why did the patient go for the accident? Why did it happen as a punishment to him? Or was it a punishment or why? Did he have any quarrel at home? And see, some differences of opinion with the superior, all these things we should have asked. No, we were not that experienced at that time. Now the next rubric is stupor after convulsions. Yes, convulsion and epilepsy. Yes, this is one of the most important reason for stupor, right? After convulsion, the patient can go into stupor. Again, belladonna is the remedy. Artemisia vulgaris. Then even it can be arsenic album or plumbum met, like if it is coming up after epilepsy. Now, stupor can come in certain fevers, like maybe some typhoid fever, or if it is a pyrexia of unknown origin, yes, where the temperature has been so high for long, 103 temperature. Why is it echoing? So in that case, the patient answers the question properly, but then the stupor immediately returns. So it can be arnica, it can be baptisia, opium, phosphorus, hyoscyamus. Now come on, differentiate all these things. The patient was having a high temperature and the patient went into stupor. And when you are there, when you are asking, come on, you are asking, you are calling out the name, and then the patient will say, hi, doctor. And the patient goes back to the stupor. Again, when you are touching the patient and calling him, hey, come on, wake up, what has happened? Hello, how are you? Then the patient will say, yes, doctor. And the patient goes into stupor again. So what is this now? If the patient is lying like a log, what is the medicine? It is phosphoric acid. Why is the patient lying like a log? The patient is damn tired. The patient cannot even, acid group, no. The patient cannot even move a finger. The patient cannot move the hand. Patient cannot move the leg. Patient will simply lie down like that with eyes closed. And when you are calling the patient will with difficulty open the eye and address the doctor and then again go into stupor. Acid force. Now opium, Again, you can look into the pupils. Of course, the pupils, the reaction may not be there always. It is not a coma case and all. But then, of course, you can always try out that. And the ailments from will help. No? What is the ailments from for opium? What is the ailments from of opium? Ailments from fright, fear. Ailments from fright, fear.
Shock.
Shock. Excellent. Ailments from fright, fear, shock. Mental shock. And in opium, how the patient will be? The patient will not be complaining about the AC because it is rather hot or rather contented. So how the facial expression of the patient will be? Very calm. He is going into stupor, no? But then there is no irritation on the face. The patient is very calmly sleeping. So that is opium. Because I have seen a case cracked by Shrikar Manu, doctor. So the child, it was an infant. Infant was lying in NICU and you are allowed to see the child only from outside through the glass window. And from there, Dr. Shrikar Manu looked at the patient for 1 minute and gave opium. Why? See? And the patient recovered. The patient, the small child was on all tubes in all orifices. And the patient was lying down like this calmly. So what is that? Because this calmness was with all these irritations, how you will be? Will you allow to, okay, come on, poke me in all the orifices? How it will be? You will be rather red in anger or that irritation will be there, right? Here yes, Shubhangi, it is contented. It is contented and based upon that opium, 1M was smeared or given or however it was administered and the child recovered. Arnica, yes. How about in arnica? In arnica, bed aggravation, right? However, the patient lies down, that part, the bed is very hard, and that is why the patient is restless. So why is the restlessness is our question. What is happening? Why are you moving so much? Why are you restless? Oh, this bed is not good. Oh, this pillow is not good. Oh, this side is not good. That side is not good. That is arnica. And baptisia, the opposite. My hand is paining when I'm like, so I'm lying this side. Oh, then this hand is paining. The parts laid on feels bruised. That is baptisia. So I am lying down in like this, and then my neck and back is hurting. So I lie down in this way, that way. The patient is constantly changing the position. That is baptisia. So that is arnica, where the bed feels hard, and opium with fear of fright or shock, and calm and contented face, and phosphoric acid due to the tiredness, not even moving, lies like a log, and hyoscyamus, that carphology will be there, no? The patient will talk and then go to stupor, but then he will be holding on to the bed sheets. He will be holding on to the bed sheets, and that is called carphology, or as if he is trying to hold on to something, no? So that is hyoscyamus. And stupor in hydrocephalus, next rubric. Yes, in hydrocephalus, if there is the cryencephalic, Dr. Arati, some input is there. There is an autism case, yeah, where mother fell in a hole a day before delivery, was in shock, no response when rescued, and child is autistic, but he is not talking and hearing, but he can actually, opium is improving him in Kerala. Well done, Arati. So what is this case? So the baby, the child is an autism case. Yeah, ailments from shock just before delivery, 1 day before delivery. This is the question, doctors. Is there a structural problem or a functional problem? In autism, from head to toe, the child is perfectly normal. It is the structure wise, it is completely normal. But behavior wise, that is functional wise, it is abnormal. The behavior is a problem. And here,
Ma'am,
yeah.
Here I took the case, but the prescription was done by senior doctors. So actually the mother told me that one time when the child's leg was actually broken, he cried out that I am in pain, but then he will not talk. So while during case taking, when we were talking, he could understand, but he was not responding, as if delusion, he's deaf and dumb. So sir took opium and is improving very well. His name is Roshan Gogu.
Has he started little bit of speech?
Yes, responding. His violence has reduced. He's improving. He was very. There were many things, and he's very better now.
Excellent,
That
excellent.
shock, I understood shock from that.
Yes, yes. So this is how the ailments from is taken, because it is a functional problem and we want to probe the mother's history in the last trimester, in the last 3 months, in the 7th, 8th, 9th month, what had happened to you, to the mother. So the mother said that just before the previous day of delivery, I fell into a hole. And how did you feel? I was damn shocked. So ailments from shock can be taken in this rubric. And one rubric from the mother, that is ailments from shock, and one rubric from the child, that is acting deaf and dumb. The child is able to understand everything, but then there was no reproduction. There is no production of voice. The Broca's area is affected. And understanding is there, but then the response is not there. The call response or response to the name was not there. After giving OPM, what potency did they give? 1M? 200? 200. Yes.
200 was given.
Okay, okay, okay. Shubhangi, did you get the rubric? One rubric is ailments from shock, which I don't know whether they have taken it or not, but then anyway, OPM is coming up there, no? And deaf and dumb, acting deaf and dumb, that was the rubric, right?
Ma'am,
Yes.
I'll share it. It is in Alua choice, and so I'll share the file.
Fine.
I took the case.
That's good. That's good. Thank you, Arati. So in hydrocephalus, that is epis, if there is the cryencephalic, and then the apocynon, yes, and Helleborus, Hyoscyamus, like Helleborus, you all know now, like the head will be boring into the pillow, yes, and there will be shaking of one hand and one leg. Hyoscyamus, Lycopodium, natrum mure. Okay, I'm not so thorough with all these things to fully discuss. Now, stupor in jaundice. There is only one remedy, that is a 3-mark remedy, chelidonium, stupor in jaundice. So in hepatocellular, where the liver is damaged and if the patient is going into stupor, you can always think about chelidonium. You can always think about chelidonium. Now the next thing is dropping of jaw. Stupor with dropping of jaw. That is lycopodium, opium, and sulfur. So again and again, opium is coming up at many places, no? Then after infections, like stupor after diarrhea and stupor after vomiting. Stupor after diarrhea, the best medicine is R-salve. R-salve. We homeopathic doctors have so much of scope in the cases of stupor. In the cases of acute stupor means what? Like if it is due to some acute diseases, acute illness like fever, or after a vomiting, or after diarrhea, if the patient is admitted to the hospital and the patient is in a semi-comatose condition, the patient is into stupor. With one dose, you can bring them out, right? How many of you have done this? How many of you have done this? With one dose, you have brought the patient out of the ICU. If it is an infection cause, R-salve 10 mg, single dose, the patient will come out. Why 10 mg? Because it is a sorosyphilitic. If it is a vomiting or diarrhea, it is soric only. But then why should the patient go into stupor? That is because of the sorosyphilitic condition. There, the best potency is R-salve 10 mg. I have done that, guys. After diarrhea, stupor after vomiting, R-salve 10 mg has brought the patient out of the ICU immediately, and the doctors will check there have been other complications as well. Why? Because of the fear. When the patient is admitted into the ICU, with fear, what will you contract with? You can contract with pneumonia, any affection of the lungs. So the patient was admitted due to something, and after being in the ICU because of the fear and things like that, the patient will go into nosocomial infections, right? Into some infectious pneumonia from the hospital. And whether R-salve will take care of all these things? Yes, very much. All this fear of death and all these things will be taken care of by R-salve. So with that one dose, the doctors will check the lungs and say, now the pneumonia is also not there. Now tomorrow I shall discharge the patient. This was the dialogue of the doctor. Whereas the doctor was talking even about ventilator. Yeah. So now during fever that we discussed, that is arnica, bapticia, phosphoric acid. Okay, stupor during menses. Will anybody get menses? Is a physiological thing. And do you need to get a stupor during menses? Which means what? It is a hysteria. It is a hysterical medicine. And the medicine is Nux moscata. Nux moscata. Stupor menses during. And this you all have to answer, okay? There is only one remedy in that. Stupor in menses suppressed from fright. Only one medicine. Opium, Shubhangi. You cracked it. Opium. Now the next is stupor in old age. Stupor in old age. Old age. Old age stupor. That is Beraita carb. Beraita carb. Why? Why? Because all these things are degenerated. No age-related atrophy, etc. happens. Yeah, so this much I wanted to discuss about. All the important sub-rubrics of stupor are discussed already now. Now, what happened to our patient here? This patient was having astrocytoma with hydrocephalus, and the patient was in coma, that is in stupor, and the symptoms were the same. That is, the patient is shrieking for a while and receding into stupor. I gave belladonna single dose. There was no change. I changed into Heliborus. Again, there was no change. I tried repeated doses of belladonna, yet there was no change. The patient succumbed to the illness and died. So this is the story. Okay, so this is a real blow to us, no? Why we talk about so much about homeopathy and what is happening when we give the medicine, why it is not working. So what are we lacking in? This is what Dr. Vijaykar sir is trying to highlight, because this is see how clearly he is bringing us into the aphorisms, into the case. If you read the aphorism from top to bottom, you will not understand anything. So now, let us go into the next paragraph. Later, as luck would have it, one of my assistant doctors again presented me a case of a male who had identical symptoms. So the nature is bent upon teaching Vijaykar sir something, no? The patients only will make you a good doctor. The patients will teach you a lot. The patients will give you a lot of motivation to treat, to read the books and understand it properly in the practical way. So here, what are the symptoms? Stupor interrupted with screaming. Yes. This time, the stupor was because of cirrhosis of liver, and the patient was in a hepatic coma. Belladonna was prescribed by her, the doctor. The patient came out of the coma. This was all. This was all the improvement she got from belladonna. Even repetition did not help. The patient did not come out of coma, but could not talk, could not move his limbs. He led a vegetable life until after 3 months of trial and error, he breathed his last. So here also the patient died. So 3 similar cases, but then everywhere the cause is different. Now, what are we learning in this thing? Are you all shocked? Do we want to continue? Give me some indication. Are you all there? What can homeopathy do? How will we all learn? And we all want to treat semi-comatose tuberous patient and all. No, we are all really enthusiastic doctors. That's why we are here in this room. Yeah. The question which arises in our mind, yes, Sai Narendra, by failures, yes, which arises in our mind is that if homeopathy is based only on symptom prescribing, why should it work in one case wonderfully, as in the first case? And why should it fail in the second one? And at the same time, why did it act partially in the third? The prescribing factor in all the 3 cases was the same. The results in all the 3 cases were different. Why this anomaly? Yeah. Now, what is Hanuman's experience? Here, Vijaykar sir is taking our hands to Dr. Hanuman's experiences. Hanuman states in aphorism 176. Dr. Hanuman has given in the theory part, from 1 to 70, it is the theory, and from 71 onwards, it is all the practical part. So, and in the last few, he has included the mental symptoms. He has included the one-sided symptoms. He has including the alternating symptoms. And he has included the, finally, the mesmerism, the suspended animation, everything possible in the disease domain, all kinds of diseases. Our Dr. Samuel Hahnemann has explored, and he has given an answer in the aphorism Only thing, we don't know to read the aphorism, and we are not interested to read the aphorism. And when a patient comes in front, we know that this is given in some aphorism, we have forgotten the number, and we cannot refer it at that time. So many hindrances. So this is the reason why Vijaykar sir has given us in the form of tablets. So what is the referral, the source for Vijaykar sir to refer? That is again Hanuman's aphorisms. So here only that particular aphorism is given. When we come to aphorism, we all have a face, no? Oh, again aphorisms. So here this is only one aphorism, okay? That is aphorism 176. So there are, however, still a few diseases which, after the most careful initial examination, present but one or two severe violent symptoms, while all the others are but indistinctly perceptible. Did anyone understand anything? This is the problem of our aphorisms. There is no straight cut to that. So there will be a maze of symptom, right? But in certain cases, there will be no maze of symptoms. There is only one symptom, that is coma, stupor, finished. Nothing else. We don't have it. We are coming into a blow. Okay. Coma or stuporous. Okay. So there is only one violent symptom, one or two, coma alternating with shrieking, two symptoms. Coma is very severe, no? Because the patient is already cut off from the world. And shrieking is also delirious. We don't want to hear any shrieking. So one or two severe violent symptoms, while all the others are but indistinctly perceptible. We will always forget about this indistinctly perceptible. What are they? Like the thermals, or like the reaction of the pupils, or the shaking, jerking of the hands and legs. All those things are there. The patient is showing it out, but then we will never see all those things, no? So this is one kind of a disease where Hanuman is giving his experience. And the other kind of thing is, that is in aphorism number 177, in order to meet most successfully such a case as this, he's giving the answer how to deal with this kind of a one-sided disease, like one or two symptoms are prominent and the others are almost nil. How to tackle this, which is a very rare occurrence. Yes, this will not happen every day, no? We are in the first place to select, guided by these few symptoms, the medicine which in our judgment is the most homeopathically indicated. Huh? What is he trying to say? Okay, so this occurs very rarely, and from these few symptoms, how that we will do? We will take the rubrics. Okay, stupor is one symptom and shrieking is another symptom. Go into the repertory and there you can try to rule in or rule out. So what all, only two symptoms are available, take that few symptoms. Take that, guided by these few symptoms, the medicine which in our judgment is the most homeopathically indicated. That is what is the answer given by Samuel Hahnemann. And the next thing is, he is continuing in aphorism 179. More frequently, however, the medicine first chosen in such a case will be only partially. Remember that arnica? After in that hit and run case, you gave arnica according to the first few symptoms, and what had happened? Partial improvement had happened. No, the patient, somewhere the life had come into the patient, but thereafter he was a vegetable. Why? Because of the limitation of the homeopath. So in such a case, it will be only partially, that is to say, not exactly suitable, as there was no considerable number of symptoms to guide to an accurate selection. There is no symptom at all. Then how can we prescribe? Take the few, those whatever is available you take, and you make a totality out of the available symptoms. Catch hold of the rubrics and the medicines, rule in and rule out and give it. So it can be partial. Okay, let it be partial, not a problem. Thus, Dr. Hahnemann himself has advocated that in cases like coma, where not many symptoms are available, the presenting one or two severe violent symptoms can be made use of to prescribe. In the above three cases, stupor alternating or interrupted by shrieking was the prescribing symptom. So far, so good. But yet, it does not give the desired result. We have done that. We have taken that rubric and we had given belladonna. We have worked out and we had given the medicine, but only partial improvement. So we shall go a little further. In aphorism 177, Hahnemann again says, we should select, guided by the symptoms, the medicine which in our judgment is most homeopathically indicated. here he has made it amply clear that it is not just, it is not just symptoms. It is the severe violent symptoms which are going to be the base of our prescription. There was no mistake from our master's side. The master did not ask you to take any Tom, Dick and Harry, any ABCD symptom and prescribe and then go into a failure. No, he asked us to pick the severe violent symptom, which will be the PQRS. So based upon that, you give a medicine and you can see the difference. How, like Dr. Srikar Manu has given that opium just by watching from out of the NICU. What did he see? That severe violent symptom, what was that? It was calm and contented. That was the striking symptom there, and that is the totality of that case. So this symptom or group of symptoms can only guide us to find the simillimum. These symptoms only help us to show us a group of remedies which can come into play. Now we have to use our judgment as to which is homeopathically indicated. This judgment will come from primary knowledge of what is homeopathicity. Are you all with me? With that violent symptom, you will be coming to belladonna, you will be coming to helleborus, sorry, you will be coming to opium, etc. Out of that, it is with your judgment of the materia medica, or you have to look into the homeopathicity. Now, what is this city? Homeopathicity includes not only similia similibus, which literally means symptom similarity, but also something more. What is this something more? I think we shall stop it here today. This something more is going to be a long paragraph, long study to reach this something more. So I think we shall go for that in the next class. Now it is 10:40 crossed. I think I should. Is there any quick discussion needed? Any questions? Anything which you have to share, or any inputs, or any understanding difficulty, or anything? And after that, we shall go in with Dr. Monica's case. Anything, doctors? Any experiences from your side or from your senior doctor's side? Everything is a learning. Everything is a learning. How to stand in a hospital is also a learning. And how to show up, how to put up there as a doctor is a learning. Your body language is a learning. Even if you don't know anything also, you know certain things to look for. The eyes, the temperature difference, or maybe the tongue if possible. And touch and feel the patient, touch the pulse, look into the respiration, warm or cold, etc. All those, look for the objective symptoms. Everybody are thorough with everything, right? That is why we don't have any doubts. Yeah.
Ma'am, can I ask one doubt, ma'am? Ma'am, if
Yes,
in
Sai
acute,
Narendra.
if it is in acute or whether it is in chronic case, whenever if you are not coming to the conflict, even though if you are getting any conflict, certain conflicts, but if there is any difficulty in converting it into rubric, so sometimes we don't get the
Yes.
conflict and we have to prescribe based on the observation. So during in the disease state, can we take only the reaction of the patient, madam? What is he do if it is in diabetes?
Yes.
What is the reaction of the patient in diabetes? Some people, they start eating more and more and more. That becomes the PQRS.
No, dear. In diabetes, the common symptoms has to be avoided. You are not treating the diabetes, right? You are treating the man with
Yes, ma'am.
diabetes. Polyphagia,
Yes, ma'am.
polydipsia, polyuria, common symptom for diabetes. If the patient is eating more, you cannot simply convert that into rubric and take in diabetes. In diabetes, you cannot take like that. So, if it is maybe in the middle of the night also, if the patient is having lot of cravings, etc., like if it is out of control, then it can be taken rather. But what you have to see in diabetes kind of diseases, in every case, the approach will be little different, right? In diabetes, what is diabetes first of all? Is it a soric hyperglycemia, or is it a psychotic diabetes where the diabetic values are maybe the PP will be somewhere around 300, 400, etc., 300, etc. And the fasting can be even 280, or fasting will be more and PP will be slightly on the lesser side, etc. Psychosis can show in all different forms. Or is it syphilitic where the patient has to administer insulin? Insulin is totally destroyed there. Insulin dependent diabetes, or if it is a juvenile diabetes or whatever, that is also a syphilitic diabetes. So whether it is a psoriatic diabetes or psychotic or syphilitic is the first question. And the second question is, why does the body want to keep a high level of sugar? What is sugar? Sugar is nothing but our energy. So where is the weakness? Why this body is, the defense mechanism is working in the opposite way? Like, why does the body want to keep the sugar levels always in the higher level? Which means, where is the stress? Where does this patient want that much of support from the glucose? So some weakness will be there, or some stress will be there in the back of the mind. And the stress will be mostly related with money, related with property, related with house, or related with loans and EMIs. And the patient will be struggling to make the two ends meet, and his children, family, all those stories will come up, especially in a psychotic thing. All these stories will come up. Or you can ask about the resistance. Why is this resistance happening? It is a non-insulin dependent diabetes. You can even give them for a check of the insulin. Fasting insulin and PP insulin, you can give them a check. If the insulin is there, sufficient amount of insulin is there, but then the insulin is not working, that is the insulin resistance. So why is this resistance? Where is this resistance that you are feeling in your life? Is the resistance with your wife? Or is the resistance with your boss or with some colleague in the hospital, colleague in your job place? Or resistance with your neighbor, resistance with your house owner? All these things can cause the stress levels, and it will want to keep the glucose levels on the high. Here and all you can ask for. These are all the conflicts which you have to, or the questions which you have to ask. And what is the reaction of the patient? I was angry, or I was angry, but then I cannot show it out. All these things, no? If it is continuing again and again and again, you can even take a delusion rubric. Yes. And if it is having lot of fluctuations, the SORA is still there. So you can even take like ailments from, although it is a psychotic thing. If it is a psychotic thing, because in diabetes, there is only functional disturbance. There is no structural disturbance. So you are justified in taking ailments from also. Or if it is going on and on continuously, very high thing means ailments from may not help. You have to take a bigger rubric, that is the delusion level rubrics. So all these things are according to the reaction of the patient only. That is combining that with the disposition. In one of the diabetic patient, he was having very less hunger. By considering appetite wanting and other symptoms, given lycopodium, and he is improving MAP. Very good, Shubhangi. So this is an opposite symptom of diabetes, no? In diabetes, polyphagia is a common symptom, so don't take that. If the opposite is happening, you can pick that rubric. Anything which is unnatural, anything which is inimical, that is what you are looking for throughout the case. Sai Narendra, did I give you the answer to your question?
Yes, ma'am. Yes, ma'am. Thank you.
You got some inputs? First of all,
Yes, ma'am.
simplify that. Thank you, Dr. Arati. Yes. So now it is 10:45 past. So can we go to Dr. Monica? She is ready with a case today. Yes. Welcome, Monica.
Yeah, ma'am. Let me share my screen. Oh, is it visible for everybody? Okay. So this was a case of secondary infertility of a Before going to the case, let me offer my prayers to our masters, Dr. Haniman and Dr. Prafful Vijaykar sir, and to my organon guru, who was late Dr. Indra Kumar sir. So this was a case of secondary infertility for 27 years old female who studied MCA and currently pursuing UPSC exams. So she has joined a coaching center and was studying for the UPSC exams. She had actually consulted me for the chronic headache and general counseling. She was having her main complaints were lack of concentration while studying. She used to feel very sleepy and irritated, couldn't show interest towards study. In spite of being ambitious to crack the exams, she could not sit and study. She could not concentrate towards her ambition. As soon as she starts studying, she gets her headache also. Headache starts from occipital region and it radiates along the spine and settles at the lumbar region. Whenever she uses computer and studying, she gets headache. It is associated with bilateral shoulder pain. She was also having a migraine for the past 10 years. She was trying for conception for more than past 1 year, 1.5 years. She was trying to get conceived. She got married at 23 years. Her first female baby was born at 24 years, and she stopped the lactation when the baby turned to 1 year, 1.5 years old. She got conceived 1 year before, but MTP was done because the baby has absence of heart rate, and so MTP was done. After that, she didn't get conceived at all. Even before her marriage, when she was 22 years old itself, she was diagnosed with left polycystic ovaries, but it was not treated. She was having irregular menses that time, but after marriage, her menses became very regular and there were no problem. She got conceived with the first baby and she got delivered everything. And now her menses is very regular. 5 by 30 days cycle is her routine. She consulted me on 16th of November, just before a day only she got her last menses. Her flow is very normal. There is no clots, no pain, not offensive. So nothing is related to the menstrual history. I probed about her sexual history. She told me that she's fearful to get conceived for the second baby because she's very much career oriented and she's very ambitious towards achieving her goal. That she doesn't want to get her second baby because that would, delay the delay achieving her goals. That was told by the patient. I want to become an IAS officer and concentrate in my career now. I don't show any interest towards sex unless my husband wants. I have not succeeded in anything. What if I end up my life only with cooking? Life space investigation. She was raised by a single mother. Her father had got separated from her mother when she was a child. And she was actually interested to get into medicine, but due to the family situation, she studied computer science, and after completing computer science also, she wanted to pursue UPSC. But because of the family situation itself, the mother forced her to get married to a 35 years old. It was almost a decade age gap between her and her husband. She was not much interested. She was having a love affair also, but because of the family situation only, she obeyed to her mother and she got married to this person. She told me, as my mother was single parent, I always don't want to trouble her. I started being bold in order to protect myself from external world. After marriage, husband is not supporting for my career, no understanding between us. Mother-in-law and sister-in-law are so dominating. Husband don't give me money for my personal expenses. I don't get respect from them. Since there is a huge age gap, the mother-in-law and sister-in-law, the in-laws are treating her as a as a kid. They are not giving equal importance or respect to her words, to her wants and needs. She told me that money is everything in the world right now, madam. I do not want to get baby and settled in family life. I just want to get into a perfect career for me so that I can be so independent and stay strong for myself, even inside home and in front of everybody in the society. So this was the constant statement which was told by the patient. uh, So she used to get angry. She was having a lot of hatreds towards her husband. Earlier, she used to shriek and stroke, but now she used to weep continuously until she gets headache, like a hysterical kind of weeping. She used to hold breath and gasp for breath while she weeps. I wanted to achieve for my mother as she had struggled. So the whole case, the whole stress points towards her career. I want to achieve my career. I want to achieve my goal. This was the constant stress of the patient. But behind achieving goal, this is not the actual passion towards her career. This is because she was undergoing a lot of trauma in her family. Her husband is not giving respect. She's not getting fulfilled of her needs, and that is why she want to achieve in career. If a person is truly oriented towards career, there will not be any other reasons. The career will be the only reason to achieve in career. But for in her case, it's not the actual passion towards career, in my understanding. And another thing is she wants to get settled in her career because she wants to take care of her mother. I wanted to achieve for my mother as she had struggled a lot to raise us. She had done everything now, and now it's my turn to take care of her. My mother always used to advise that after her death, I should be independent enough to support myself. I want to get a job so that I can care my mother and be respectful in front of my in-laws, as they are already treating me lowly. What if my mother dies? My only wish is to become financially independent and sound in life before my mother dies. She shouldn't die with worries about me. So this patient was having a lot of insecurity about the life of mother. That's why she was diagnosed with left polycystic ovaries even before her marriage. She is very, very fearful that if what if my mother dies? What if my mother is not there for me? Then who will support me? A lot of insecurity, there is no father, there is no supporting sibling, there is no supportive relatives. She was having a grandfather who are very old enough, not enough to support her. And her mother is somehow managing her every now and then to support her financially, to give her emotional security. Husband is not supporting as well. The in-laws are not supporting and dominating her. So her whole life, it seems like she is dependent on mother. And what if the mother dies? I will not be well enough to live my life. So this was the insecurity which has been running throughout the case. By nature, she was a timid person and was into sports like throwball and running when she was doing school. She used to miss her mother because her mother was in the police department, and she used to be busy in her works. And during her childhood, she was attached with grandfather as there was no other option. So she missed the love of mother. She was average in studies, did not have many friends. She was having a desire for ice cream, so she was a hot patient and decided to travel. But last 4 years, she couldn't because of the family situation and strictness of in-laws and husband. Just before consulting me, 2-3 weeks before only, she had consulted a gynec, and the gynec had given her vitamin tablets, folate tablets, to take for 1 month. And after 1 month, she was about to go for the HSG, hysterosalpingography, to verify whether there is any adhesions or tubal blocks. I suggested her not to go for it and advised her to wait until the further follow-ups. Myasm layer of the disease, headache belongs to 6th layer, pseudo-psychotic. It was a chronic headache. Secondary infertility belongs to 5th layer, and the syphilis because the basic nature to procreate in the female is being lost. The interest to procreate in the female is being lost. And the problem of this patient is at the level of a sexual identity. Now, rubrics, can anybody guess the rubrics? Okay. So these were the two rubrics: delusion, imaginations, dead mother. It was a lot of fear and insecurity about the mother. So to a higher degree, I consider this rubric, delusion, dead mother. And the second rubric, female coition aversion to. These were the two rubrics I consider. Natrum mur and lachesis were the two remedies that I got. Out of it, I had chosen Natrum mur. 10 one dose was prescribed on 20/11/24. And on 23/12, 1 month later, patient informed me over call to inform me that her CAR test is positive since her menses got delayed by a week. In the evening, her blood HCG was 673.4, which was positive for 4 to 5 weeks of pregnancy, and there were no psychotic pathologies. That was additional advantage of this case, because if there were any other pathologies, it would have taken much more time. So this is like a functional, drawback at the patient, at the psyche of a patient. So with the single dose of a proper medicine, she got pregnant. So this were the report. Thank you. That was into my case. Thank you.
Thank you, Monica. Thank you for the case presentation.
Thank
So
you, ma'am.
lot more studies, no, lot more things to learn. Like whenever any doctor who presents the case, no, they are also, I congratulate them, because they also take the time to make the presentations and the slides, etc., and the work behind that, and the whatever results it is, to present the result in a platform. How glad it is. We are so glad that you are all getting results. And I encourage even other doctors who have not yet presented the cases to present any of your cases, be it a cold cough, anything, be it a psoriatic case, be it a psychotic or anything. It need not be syphilitic always. And here in infertility, it cannot be always, infertility means they are not able to conceive. And all those things cannot be always syphilitic miasm. It is all depending upon the cause. What has made this patient infertile? So if it is a psoriatic infertility, like it has worked immediately. Like if it is a psychotic, then it can be due to some PCOD or due to fibroids, or huge fibroids can sometimes act as contraceptives, right? It will prevent the conception. Or is it because of some cyst in the ovaries? All these things can be psychotic miasm, and sometimes syphilitic miasm, where even the egg is not produced, where the AMH is so low that even the egg is not produced, or some teratoma kind of thing, some cancerous abnormal cells coming up, or from the husband side, if there is total azoospermia and all, it can be of the syphilitic variety also. So infertility also can be of psoriatic, psychotic, and syphilitic according to the cause of the case. But then anyway, nice presentation, Monica. Thank you so much for presenting this case today. And with that, let us call it a day. And we shall all see in the next week, hopefully. Thank you so much again. And thank you so much for all the encouragement and support from your side.